Butt wink. What is it actually? Who cares? Should you care? What does Stuart McGill, the leading back pain expert, think? And so much more. Today we are going to talk all things butt wink. So firstly, we need to know what it is. Butt wink is when your pelvis goes from neutral to posterior pelvic tilt. And it's basically signified by when you watch someone effectively go down in a squat, they're going to come down and they're sort of round their butt under, and then it comes back up as they go back into the concentric part of a squat. That's going to be primarily dictated by your structure. What I mean by your structure is your acetabulum, which is your hip socket, and your femoral head. So when your femur goes into your hip socket, we all have different set hip sockets. So some of us are more what's called retroverted or antiverted. So that basically means, where does your hip socket, so if this is my left hip, then this is my hip socket, this is my femur. Where does my hip socket sort of sit? So if my hip socket sits quite retroverted, what's going to happen is, if I want to come through in this angle, which is leading into that squat position, my acetabulum is going to stop me from doing that. But I can do it out in this position here. Okay, if I'm antiverted, which is what you'll see with a lot of like Asians who can sit ass to grass in a squat for ages, no dramas, is their hip socket will be antiverted. So they've actually got heaps of range to come straight forward and through there, but they may not be able to do super wide positions. And everyone's hip mechanics is going to be the biggest dictator in when, where, and if you are going to butt wink in a squat. The other thing that we need to take note of is pelvic control and pelvic awareness, because a lot of people, especially when you're learning or you're not bracing effectively, they just sort of drop down and come back out. And there is something to be said about the control of the pelvis and the deep core that is going to stabilize you and maintain neutral spine in those positions. So should we be concerned about butt wink? Is it just a structural thing and you just sort of work with what you've got? Or if you can't squat deep, you can't squat deep. Or is it something a little bit more sinister? So I want to tell a story first. Dr. Stuart McGill, who is the leading researcher on low back pain, attempted to do a study on low back pain and butt wink. And what he did is, across the board, 40 kilos on a back squat, and there were two groups. There were people who went through into butt wink and people who did not go through butt wink. And this wasn't predetermined by their structure or anything like that, but he forced some people to butt wink and he kept some people away from that. So I think there's a few things that are important to note. This study was never published. Now, it's really interesting to know that, because of the fact that he said that a lot of the participants in the butt wink group actually reported low back pain and dropped out of the study. Now, first when I heard that, I was like, whoa, butt wink is the devil. Like, don't do it. Which, you know, like, from an unpublished study is very hard to say for certainty. And I think there's also something to be said about, you know, were these people bracing? Were they in a position that allowed them to get deep enough? And maybe that wasn't a great position for their hips in the first place. So, you know, maybe there was some hip impingement involved because they physically were forcing them into this position that may not have suited them. Now, this probably still advocates for saying that butt wink isn't great. However, I think it's really dependent on a few things. I think that it is dependent on the load that you have. So I guess my stance on this is that I wouldn't be loading someone up incredibly heavy, making them go ass to grass if they didn't have good pelvic control, and if they were sort of just dropping in and out of posterior pelvic tilt. So takeaways from this is that people's structure will determine their function. So don't force someone into a specific stance with a squat. Trying to maintain a straight spine will give you a stronger position, but not necessarily mean that butt wink is bad or the devil. But it is important to understand that butt wink may have its place in actually creating some tension to both stretch and then contract the erectors. And I think that's not something that's often talked about because it's sort of disregarded or dismissed as, you know, that's bad for us, so don't do it. I think that we need to be aware of pelvic and core positioning, and there is a big difference between butt wink because I flopped into the bottom of a squat position and butt wink that was controlled on the way down and I was bracing, and that's just structurally where my hips sort of had to tuck under because of my pelvic position if I wanted to hit that depth. But as with anything, that is my opinion based on my own personal experiences and experience with clients. I would love to hear what your experiences are and continue talking and debating and discussing this in the comments section below.